Hello. Today we're going to talk a little bit about newborn babies and breathing patterns and what's normal and what's not. So all babies, when they're newborns, they breathe a little faster than other children. Typically anywhere from like 40 to 60 breaths per minute, and that's normal. Sometimes some babies will have something called periodic breathing, where they breathe fast and they slow down for about 10 seconds, and then they breathe fast again and slow down for about 10 seconds. That's okay, not to worry. As long as they look fine and they're continuing to thrive, there's nothing to worry about. So some babies will breathe fast when they're angry, when they're crying, when they're upset. But as long as when they settle down, the breathing gets back to less than 60 breaths per minute, that's okay. When do you worry about your child's breathing pattern? Well, first, when it's more than 60 breaths a minute for a continuous amount of time. But when it's constantly there, even when they're happy and they're calm at rest, that's when you should worry. Also, if their breathing is fast when they're sleeping, you should worry about that as well, because usually the babies, when they're sleeping, their breathing will slow down a little bit. Other reasons to worry is when it looks like the baby's having a hard time breathing, like when they're sweating, when they're breathing, when they're head bobbing, like moving their heads a lot when they're breathing, when their skin around their neck and here in this area here by the windpipe, around their ribs and underneath their rib cage, around their belly sinks in. That's called retractions. That is not a good sign and is something that you should worry about and ask your pediatrician about. Other things to worry about is the noise that your baby is making when they're breathing. For example, wheezing or whistling in their chest, if they're making a noise when breathing in. Also, if they're grunting. Grunting is when they're forcefully exhaling, or like a deep sigh or moan when they're exhaling or breathing out. Those are signs that there's something else going on and there might be some distress. Other things is discoloration. If the baby has discoloration of their skin, like a bluish tone in their skin around their lips, that is something to be concerned about. That means they're not getting enough oxygen when they're trying to breathe. And also when the babies are taking deep, longer pauses in breathing. So if your baby is breathing and takes pauses in breathing that are 20 seconds or more, you should be concerned about that. Especially when sleeping. If that happens when sleeping, you should talk to your pediatrician immediately about that. So any sign of discomfort, any discoloration of their skin, or if they're breathing too fast, more than 60 breaths a minute continuously or during sleep, you should talk to your pediatrician immediately and seek medical care.